So patients come in and they often ask, what's a full mouth reconstruction? Why do we need a full mouth reconstruction? They come in, they want veneers, they want the front teeth done, they just want something pretty and white. And sometimes they come in and their bite, their teeth are so debilitated that veneers or cosmetic crowns are not feasible without restoring the rest of the mouth. Sometimes they come in and they've got a lot of decay or old fillings or bad crowns that don't fit properly that may be causing gum disease and other things. And with the collapsed bite, we can create problems that would relate to TMJ problems, and with their occlusion, it can cause different issues for them. And then with the poor fitting restorations, bad crowns, bad fillings, and things like that, it'll make the periodontal disease, things of that nature, worse. So in our clinic, we do a lot of full mouth reconstruction. And what the process is involved is the patients will come in, they'll look at the photos, we'll discuss with them what their needs are, we'll get the box out, show them what molds of teeth we've got. They'll decide, hey, I want to look like this or that. Or some patients come in with a picture of their teeth before they were worn out, and we'll take models of their mouth, we'll do what diagnostic wax up of what it's going to look like when it's finished. Why do we do that? Well, when the patients come in, typically they get their teeth prepped, they get temporaries on, and they get their crowns at most offices. What we do different here is we take the time to figure out what you want, show it to you, and then have it designed. When you leave my office, we'll prep all your teeth while you're sedated. You'll leave with beautiful temporaries that look just like the final product. We're going to give you a week, 2 weeks, however long it takes to wear those teeth, look at them at home in your mirror, let your friends see them, your family see them. Make sure you love your new smile. If there's anything you don't love about that new smile, we're able to change that for you in the temporaries. And then once it's where you love it, then we'll make records, impressions, photos of that, send it to our skilled lab technicians at our lab. They'll make the crowns, and there's no surprises. And that's what we love about this. It's so predictable. We know that the end product's going to be a slam dunk for you, and that it's going to be a smile that you can be happy with, and a smile that you'll be comfortable with, and that'll work great for you.